we're honored to be able to meet women in a space of total vulnerability. As you said, it's aloneness, it's shame, it's deeply emotional, depending on how bad it's gotten, right? To be able to show up there and meet women there and walk them through a healing journey that we've walked ourselves is the greatest gift. We just don't know. I always get emotional. We don't know the form that our gifts in life are going to take. It doesn't look like a gift when you first become hurt, when your marriage is impacted and you're not showing up, as the mom you wanted to be. But then it becomes a gift when you then can meet someone else from a place of total compassion. Like, I know what this feels like, and I have something that might help you.
Okay, ladies, if you have ever had any challenges with your pelvic floor, which research shows that's 50% of the women out there, and you have felt alone, isolated, or possibly ashamed, this is the episode for you. In this segment, I interview Christina Walsh. She is a physical therapist. She has an incredible story, and she leaves the listeners with great take-home, tangible tools that you can use today that are so simple and easy to apply. She also is a girl's girl. I loved this conversation. She really sees the body from such a holistic perspective. She pulls in the emotional aspect. She talks about how our pelvic floor challenges can keep us in a state of fight or flight, and how in a 5-minute fix, we can completely unwind that. Christina has a way of taking information that, again, many women may be too ashamed to even talk about with their closest friends. She keeps it super light, interesting, engaging, fun, and empowering. So excited for you to have this incredible, life-changing information. Hey, real quick, have you ever felt like there's no time to rest, put your feet up, or even think about picking up a book? That's exactly why I created Best Friends Book Nook. This is not your typical book club. It's designed for busy women just like us who are wanting to connect with ourselves, grow, but without the pressure. In this free community, we choose inspiring, easy-to-read books and create space for ourselves, even if it's just 5 minutes a day, to breathe, reset, and finally enjoy a little me time. The best part, we have regular community connection calls where we share insights, connect, and support each other. If this sounds like what you've been craving, check the links to Book Nook in the description. We'd love to see you there. Now, back to the show. Something I love bringing onto my podcast, the people I love bringing on, the conversations I like to have, whether it's my podcast or my Instagram or anything, it's like I want to normalize the topics and conversations that aren't out there or are like taboo or women are too embarrassed to talk about. And this is such a big one. I mean, I was just reading an article from, I think it was the NIH. Is it the NIH? Yeah. 1/4 to a half of all women experience pelvic floor issues. And these women are either just accepting them as fact or too embarrassed to seek help. So this is such an important topic and conversation. I hope for any woman who feels alone in this struggle that she no longer feels that way, and that she's going to leave here with some really important information and feel inspired and empowered.
That is exactly why we're here doing what we do, because for my partner, Jen, and I, it is so deeply personal. But we've walked different versions of the path, but that's what brought us together in total conviction that we had to find and get out there a better way of caring for these issues for women, because the things that were being offered to us to heal, either we tried and didn't work or didn't appeal to us. And so we're honored to be able to meet women in a space of total vulnerability. As you said, it's aloneness, it's shame, it's deeply emotional, depending on how bad it's gotten. Right. To be able to show up there and meet women there and walk them through a healing journey that we've walked ourselves is the greatest gift. We just don't know. I always get emotional. We don't know the form that our gifts in life are going to take. It doesn't look like a gift when you first become hurt, when your marriage is impacted and you're not showing up, as the mom you wanted to be. But then it becomes a gift when you then can meet someone else from a place of total compassion. Like, I know what this feels like, and I have something that might help you. And so whether you end up working with us in our program or not is not the point right now. The point is exactly what you said. We have tons of free teaching on our YouTube channel. We always tell everybody it's the stuff you're probably afraid to Google because we go deep. It's so scary often to confront these issues because a lot of times they've crept up slowly over years. Maybe after the first baby, it was just a little leak when you jump on the trampoline. Maybe after the second, when your back is always tight now. Maybe if you have a third, all of a sudden you can't get to the toilet on time. Now there's urgency on top of it. Then your intimate life with your partner is being impacted because it's either less satisfying for you or, God forbid, it's hurting. And these things you cannot ignore anymore. And it's that threshold where women are like, I need help. And we go into all these little nuanced areas of what this can look like for every woman because it is different for each of us, right? Because it's complex, but we go into all those different areas. We talk about the terminology around all of this in so many in-depth teachings, and we can go down any of those rabbit holes here today, as well as action steps that start moving the needle in the right direction. But yeah, let me know what you think your listeners want to hear the most about, because we can dive into any of those topics. And you can find more information about any of the rest of them on our Instagram and YouTube.
Perfect. Yeah. I mean, just like I want to pick your brain on you talk about the relationship between like pelvic floor dysfunction or challenges and our nervous system regulation. You talk about pelvic floor and lymph flow. So many rabbit holes we're going to go down. We're going to keep this super simple so the listeners can really walk away with some tangible information. But first, I love when people get teared up. I love when people's mess becomes their message. These are my people because, like you said, you have walked this path. And so when you learn from someone like Christina, like there is an empathy there. There is like I got you, and I had to create the solutions that I didn't have for myself. These are my favorite kind of people. So I would love for you to share, even just a little bit of like how you got into this. Obviously, you're a physical therapist. I'm curious if you were that first and then had some challenges with pelvic floor. Like, how did that all come to be?
It is so interesting, and it is exactly what you said. It's the making the mess your message, and it's recognizing that maybe this thing that was really harmful and really hurt you can become a gift of service to others, and that happened multiple times. Like, it was a very circuitous path to get here. I did not know so many steps that were happening were leading me to my life's purpose at the time. I'm sure that's the story for so many of us, right? We just have to open our heart to receive that. I honestly think seeds were planted. I'm the oldest of four kids, and my mom suffered with a ton of back pain. And she would have to, like cooking dinner, she would have to lie down to rest her back. She could not stand for long periods of time. And she was thin and healthy. It was like it didn't make sense.
Yeah.
And even as a kid, I think as the oldest of four kids and the daughter, I wished I could help her and I couldn't. I didn't know how. I mean, we would help, but I couldn't help her heal. And I think that's what got me interested in healthcare and the body and led me down the path of physical therapy, because I was like, I want to learn more about this so I can be that person for someone, for many people. I had an aunt who was a PT and just talked about how much she loved her job. And so I went to physical therapy school, did all that, got out. I started thinking, I'm interested in women's health and working with moms, but that, life didn't take me directly to that kind of next level of training. I ended up working in orthopedics. I worked in home health. And then I hurt my neck in a whiplash injury. That was the first time I had to come face to face with what a healing journey feels like in your own body. I was young. I was in my mid 20s and maybe late 20s. And I instantly was like, oh my gosh, the Western medical system does not have what I want to heal. And I also had the perspective of helping others heal to know like where I didn't want it to go. I didn't want to end up on a surgeon's table at 35 having a neck operation. So I was like, I have to heal this. And at first I came upon craniosacral therapy as the first alternative practice that I was like, my jaw dropped in that first session on this woman's table. And I was like, I have to drop everything and study this. Like this, I think that's what I abstractly thought the kind of care I was going to be providing as a PT, but then I wasn't. So it's like, no, this is what I have to do. So I went to study that and I started my own practice. And then lo and behold, the next blessing is the woman who ended up on my treatment table seeking care for birth injuries and a diastasis recti was Miss Jen Lorman, exercise physiologist extraordinaire, who is now my business partner. And then she was like, oh my gosh, I work with moms in my personal training studio. Every single one of them needs this care. Will you please come practice out of my gym? And I was like, oh my gosh, yes, the
Mhm.
stars are aligning. I'm going to get to work with moms. I hadn't had kids yet. And she already was doing a certain type of work. And then I had a few babies. She had had very traumatic births, like forceps, vacuum, fourth degree tear. So she was already trying to recover from all that. And then I had a couple babies that, again, I had the forethought of like, I saw what happened caring for moms with births that were very intervened upon. So I was like, oh, I'm not going to do that. I'm going to get a doula. I'm going to have a midwife. But guess what? We don't get to control everything when we give birth.
Yeah.
And so I had
It's their
two
story
sunny side,
too. It's our baby's
right?
story too.
Yes, and you
Yes.
can set all the variables up that you have control over, but I still had 2 sunny side up deliveries. I
Mhm.
still pushed for 2.5 hours, no medical intervention. I didn't tear, but come to find out, pushing for more than 2 hours puts you at risk for pelvic floor issues and prolapse, and so between the 2 of us, we have this whole spectrum of stories of birth and severity of what these issues can do to your life. But both of us still wanted to get better, and Kegels didn't work. We tried those. It can just lead to over tightening. Jen was being referred for major reconstructive surgery at 36 and was like,
Wow.
absolutely not going to be my story.
Yeah.
And so we went on the warpath, you could say, to find a better way. We went to a continuing education course, found a new tool that was fully external, non-invasive, and was actually helping us to rebuild a balanced functional strength in our whole core and pelvic floor. We're like, oh my God, we're going to get this out to the world. We took on the crazy project of doing a university research study, which we did not know what we were getting ourselves into at all. But we were like, this is going to be our big splash in the world. We're going to change the field.
That's
Okay.
amazing.
Right. Okay. It's really cool. But it took years. We
Yeah.
finally got it published in the Journal of Women's and Pelvic Health Physical Therapy in a peer-reviewed journal. That was what we thought that was the end of the story. We were
Mhm.
just going to keep doing our in-person practice. And then the women in our research came back and they were like, please put this online. Like, so many women I know need this. And we were like, we need to listen to these women. And Tighten Your Tinkler was born. One of them named it for us. And we've been on this journey ever since. And it's been utterly miraculous to truly help change women's lives around the globe. We've never met any of them. And yet, the success stories continue to roll in of changes that they had just previously given up on. And I could not be more honored to be here sharing this message of hope for anyone who needs to hear it.
I love this. I mean, you guys are adorable. You guys slid into my DMs, I don't know, 2 months ago. And honestly, normally when someone is sliding in and like kind of asking to be on the podcast, I usually I'm like, I just need some time. Like I've got a full schedule already. And you guys were so freaking cute and funny and bring to light a topic that can just be like stressful and embarrassing and shameful and isolating. And I was like, I gotta have you on. So let's dive in. I mean, I have those like I'll call them rabbit hole questions and conversations I want to ask you about the other stuff, but you're talking about an external device. And so for those of us who maybe this is unfamiliar to, all I've heard of really is Kegels. Just going back, we have a wellness practice in New Jersey. And at one point, we had a manual pelvic physical therapist in our practice. And she taught me so much. I mean, she was like, in Europe, this is the standard
Yes.
of care for women leading up to and after babies. And in the
Yep.
US, we just don't do that. And so I think we should definitely address that and maybe talk about like, why is this important? What is it that you do as a manual physical therapist? And then let's talk about like some of these external tools because I've only heard of like the internal Kegel.
Totally. And I love that you're bringing all this up because inevitably one of the things we talk about always is how can I get better? What are my options? And on the one hand, it's such a great blessing that now I think so many our people are like, we need to solve this problem. There are a lot of options out there. And so on the one hand, that is fantastic because every woman can choose the path that feels aligned and accessible and right for her. On the other hand, it can be very overwhelming.
Very overwhelming.
It's always the
Mhm.
catch 22 of the
Right.
digital world.
Right, because you're like, what am I going to order these like essentially seem like vibrators and like try them out in the solitude of my bedroom? I have no idea what the hell I'm doing. I'm gonna
Yeah.
like shoot this thing out to the wall. I don't know what to do with it.
Right, right. I think that this is a very important point when we are trying to address issues at our very center. It is our energetic center as women, our emotional center, and literally our center of gravity from a physics
Yeah.
standpoint, right between the pubic bone and that second sacral segment, right?
Yeah.
So very much our center. When we're addressing healing here, it is very often deeply emotional, and so for some women, they like the idea of being alone and touching that area internally and like really feeling things that way. For other women, maybe who have either had birth trauma or sexual trauma, the idea of penetrating themselves with a device, by themselves is terrifying and frightening, can be re-traumatizing, re-triggering. Some women have access to an in-person provider geographically or logistically. Some don't at all. Like the nearest one is 2 hours away, or I don't have childcare, or, I don't want to have to disrobe to fix these issues. I'd like to be able to do it in the comfort of my own home with my kids present. So again, you do you, right? Like if you feel called to see someone in person and that feels like the path to healing that's right for you, then do that. If you feel like you're more of a DIYer or holistic health type of person, you'd like to keep it external, you'd like to keep your clothes on and do it from home, then something like what we're offering is a fantastic option for you. And so it's truly turning in, tuning in, knowing yourself, investigating your options. And that's part of why we try to stay so present on all the digital platforms, is because we want you to kind of get to know us. Like it's such an intimate place to heal. If you feel our vibe and you like the way we talk about this stuff, then we probably are a good fit. And if you're like, nope, not with these two, then go find something else. There are a lot of options, and it really is. I hope that helps women feel a freedom to solve these issues in a way that is the right fit for them. And we always walk women first through our 5-minute quiz. So that's another piece of what's right for me that we have dialed in. If you're like, gosh, I love these girls, I love this approach, the first step is taking our quiz, which we have linked in all our places. And what we
Mhm.
did was we just took the research questionnaires that we used to track our participants' progress in our study, turned them into a 5-minute online quiz. And it's really cool because not only will it help you kind of connect the dots between a lot of issues that you might have thought of like as separate little buckets that are actually all connected. So the good news there is that they can also be healed at one time, but it will
Right.
also give you a score and report where like Jen and I don't want to walk anyone into our program who is not the right fit from a symptom standpoint either. So that quiz lets us tell you with confidence, yes, definitely. You scored exactly like the women in our study who did really, really well with this protocol. Or if not, if your score is too high, we have a whole page of resources for in-person care that we refer you to. So we've got that whole system set up to help, sort who's the right fit for this approach in that way as well, not only just tapping into your intuition about what's right for you, but based on your symptoms.
So beautiful. Yeah, because I think that takes out a lot of the overwhelm. Like, is this a solution for me? Which direction should I go? Yeah, so we'll make sure we link that. All your stuff is going to be linked in the show notes. I want to go back to talking about, we were talking a little bit before we started filming about the center.
Yeah.
And, you touched on some really beautiful, important aspects. You had mentioned a podcast I had done with Dr. Sonia Jensen, and a
Yes.
beautiful conversation around how intimate this area of our body is, and that it's so much more than maybe what we give it credit for. So tell me more about that.
Well, I just connected so deeply with that interview with Dr. Sonia because it spoke to my heart about kind of the intersection of those two backstories of mine, where I do still maintain a part-time bodywork practice doing craniosacral therapy in person because I love that so much too. And I literally, with my hands, feel the layers of grief and shame and stress and fear that emanate from our tissue when we are in that place of trust and healing. And we store a lot of that in our pelvis as women at our center. And that's not surprising at all. And the way Dr. Sonia led all that into the conversation so well, too, where she said, we develop a bond of trust when I'm caring for a woman. And then I start to ask those questions, where in those body work sessions, I always ask the woman's body, do we want to talk about this or not? And sometimes our body just wants to be held and release some of that all subconsciously. And sometimes we need to have a dialogue about it. But it just speaks so strongly to how intimate and emotional healing this part of our body really is. And I get the gift of actually feeling that with my hands in women's tissue. And then I get the gift of guiding women through a totally digital, not in person place. And that's part of why our program isn't just do these exercises. We have book recommendations. A lot of them are all of your favorite books, actually, as
Mhm.
well.
Which
We talk about managing the emotional ups and downs, and we have a private support community for our members because the farther this has gone in impacting your life, the more emotional it will be to look it in the eyes and go, sometimes the first step in healing is acknowledging how bad it's gotten, right?
yeah.
To seek help, we
Mhm.
have to say, I'm not well. And just that step alone, like I said, so often we feel kind of able to ignore this stuff for years because it wasn't screaming loud enough to really warrant our attention. But it crosses a threshold where all of a sudden you look it in the eyes and say, oh gosh, here I am. And we tune in, we start listening to our body and feeling what it's really trying to tell us. Sometimes it feels harder before it gets better because you've just encountered that brokenness that you're feeling in a whole new way before you start getting better. So we teach gentle techniques in the program, and we have some free access to some of those as well because it's a great place to start healing, to encounter your body with gentle decompression, with gentle care, because decompressing and pouring compassion and gentleness into ourselves to help relax and release tightness is the first step before we build the strength, because it has to come in that order. Because if we just rush through one of those healing steps, it's not going to end up with the same result, you know?
Yeah. Oh, for sure. Gosh, so many good things. I want to ask, what are some of the books that you recommend? You know, I love
Oh, we
books.
love Untethered Soul. We love The
Ah,
Body Keeps the Score. We love You Can Heal Your Life by Louise Hay. We love Brene Brown, what else is on our list? All that good stuff that you
so beautiful. So this is someone who's helping with pelvic dysfunction with a passion for tuning into our inner voice and healing ourselves.
Mhm.
Like, what a beautiful, incredible marriage. You
'Cause I
know,
don't see how you can separate the 2.
you
Honestly,
can't. You
it
can't.
it's crazy to try to act like those are separate things, you know?
Right. Like, I mean, my chiropractic lens is on, right? And I've got this whole visual that I want to kind of help draw for anyone listening in the audience who perhaps doesn't have a background in physical therapy or body work or chiropractic, right? So a couple of things which Christina has definitely touched on, but the book The Body Keeps the Score is a great book because it literally talks about we store emotions in our tissues and muscles, and some people call these samaskaras, right? So they're, whether it's anger or shame or grief or guilt or
Mhm.
envy or trauma, big T trauma or little t trauma, it's stored in our body. And we've done this quote unquote incredible job as women as like stuffing it down. We talk about this a lot.
Right, and think about prolapse is like a falling down of the organs, and Jen constantly, my partner, always talks about, she's like, "It's not lost on me that I grew up in a very traumatic household where I had to learn to push it down, push it down." She's like, "And now my organs are falling down," you know?
There's so much to that, right? There's so much. I mean, trust issues show up in the pelvis. You think about, okay, we're mammals. A lot of mammals have a tail. And when mammals are stuck in fight or flight or scared, where does their tail go? It tucks under. Ours is the same, right? And
Yeah.
so there's these pelvic muscles that hold really tight
Yes.
that need to be released in order for us to let go of that hold on fight or flight, right? It's like
Yes.
we can treat it from the outside, but if we're not working on the inside, we're putting a band-aid on a bullet wound.
Yeah, and the results won't be the same. You'll make some progress, but then you'll still feel stuck in some kind of loop where, like, why can't I get past this next layer of healing? And it's like, well, we have to go a little deeper. But then when we do, I mean, the upward spiral of healing that we start, right? Our posture becomes more upright. Our confidence in every aspect of life just starts to glow, and we start having wins in little places that didn't seem connected. I mean, you know how it goes.
Yes, yes, we've gotta clear the issues in the tissues, and then everything's open and aligned.
Yeah, and honor the fact that your body's story isn't, so often it feels, for some women, it feels like, why did this just happen all of a sudden? Right. And that's never the whole story at all. Our body tells our whole story. So our pelvic floor health began so long before we had babies. And yes, having a pregnancy and childbirth is the greatest risk factor statistically for having pelvic floor issues and prolapse. However, so many factors come into play long before that, such as, and this applies to my partner Jen, she had a history of asthma and chronic coughing. Think about the repetitive downward pressure every time, over years and years of coughing. That pelvic floor is squeezing and guarding to try to hold everything in. Or
Yeah.
a lifetime, if you have a history of bowel issues, a lifetime of chronic constipation and straining, is repetitive downward pressure is not doing any favors for the pelvic floor over the long term. A lifetime exactly of what you said of high anxiety or overachieving, where we're in a state of mild to exaggerated fight or flight chronically, and all those muscles just end up like guarding and squeezing. They're doing this thing. Our bodies are always doing their very best they can to help us and to be on our side, but sometimes we have to give them a gentler and more compassionate nudge in the direction they already want to go. Our bodies are healing machines, right? But if we don't set up the scenario and the environment for them to heal, they can't do it. And so that's so much of what this is about. And I want women to hear validation and feel like, why did this happen to me? I see other women and they're not dealing with this. Well, first of all, have you asked them? Because it's not a
50,
visible
50%,
problem.
50% of women are.
Yes. And so it's easy to feel very alone in these issues, but I want women to feel validated, not only that they're not alone, but that so many factors contribute to this over a lifespan. So yes, it could be pregnancy and birth, but maybe some things were being set into play even long before that.
Definitely important. All right. Well, while we're kind of on this topic, are there more things that the listeners should know about, pelvic floor and like regulating our nervous system, right? So like having the ability you just touched on, the body is miraculous. It's reacting to our environment, right? And so sometimes we can't change our environment. So if you're someone who's living in a chronic state of stress, which most of us are, our body's perceiving like constant threats, even though they're not. Like for the most part, our survival is not threatened, but our body holds as if we are. So you talked about the connection with the pelvic floor and regulating our nervous system, having that ability to calm down when maybe we're ramped up, but the reality is we are safe, so we can let the guard down. We just have like an intense deadline at work, or our children are fighting, right? So we can actually just kind of, it's okay. I can choose to breathe and regulate myself. What is the connection between pelvic floor and that ability to do that?
Hey, real quick, I love tools that help us feel more grounded and connected, right? That's why I am obsessed with a higher dose PEMF mat. It's my go-to for the moments when life feels overwhelming and I just need a reset. This mat uses PEMF technology to help calm your nervous system, reduce stress, and recharge your energy all in just a few minutes. So whether I'm taking a break from life, looking to unwind after a hectic day, recover from workouts, or just simply catch my breath, it's like giving my body that ultimate recharge. So seriously, if you're looking for an easy way to feel balanced and relaxed, you've got to check it out. For all my favorite higher dose products and an epic discount code just for you, check out my links in the description. Now let's get back to the show.
Well, one of the things you already described more beautifully than I ever have, honestly, is the kind of that tail tucking muscle guarding, because we don't realize often it's in our jaw or our shoulders, but often it's in our pelvic floor or low back that we're guarding in an effort to kind of protect ourselves in those heightened, sympathetic nervous system, right? But that's that fight or flight system, heightened states. But that sympathetic nervous system, that fight or flight piece, also connects directly to the bladder itself. So while it has to do with muscle guarding and tightening, it also has to do with the bladder itself, telling the bladder, oh my gosh, we need to go. We got to empty. And then the bladder is feeling panicked. So
Mhm.
a lot of times women come with that urgency leakage, that gotta go now, but you can't get to the potty on time kind of leaks. So there's the laugh, cough, sneeze, jump leaks, but then there's the urgency leaks also. None of that's normal, nor do you have to accept it as your new normal. But the urgency leaks specifically are often connected to that nervous system piece with the bladder. So in order to really heal those leaks specifically, or that chronically over tightened pelvic floor, we have to give our body that input of, I'm safe. It's going to be okay. Give our nervous system that downward regulation, which I love the way you coach women through that. So look, all of you listening who are participating in Dr. Melissa's 5-minute sit spot, you are doing something good for your pelvic floor in the process. So like,
Side
and we
benefits.
have,
I love
I
side
mean, right?
benefits.
It's the upward spiral of healing, and we offer that free access to an at-home decompression position that you can access. It's one of the relief techniques that we teach in our program, but you can get access to that, and it's just a position you put your body in at home for 5 to 10 minutes that gives you a little self-adjustment, not in the way a professional chiropractor can. So if you're really out of whack, you still need to get that professional care. But it's an anti-gravity position that you put your body in where it just helps the low back, the pelvis, the pelvic organs, the pelvic floor to decompress and offload, but it also down regulates your nervous system at the same time. So I'm always like, look, you're rest multitasking. For those of you who have a hard time sitting still for 5 minutes, put on a meditation app or your favorite podcasts and just lay there and know how much good you're doing for your bladder, your whole body, your sense of well-being, your back, your hips.
I love that. It's beautiful because it's easy, it's accessible, right? And you can, multitask and get a few things done at the same time.
It's a beautiful first step.
Yeah. So that's a free resource. We'll link that below. Add it to your 5-minute sit spot, those of you doing that. Another cool thing for the listeners to do, and maybe my YouTube editor for at least the video version of this can put up an image of the pelvic floor. Because I think, do you have one too?
I,
Oh, beautiful. Yes. Okay.
I happen to love teaching with my pelvis model.
Okay. So for the YouTube version, we're showing this. And for the podcast version, they'll just be listening. But, those listeners can always head over to the YouTube version because this is crucial. I think a lot of women hear pelvic floor and they might think of certain structures or pieces.
This is what Jen and I always use the phrase, the pelvic floor is not a magical unicorn. And what we mean by that is so often it's treated as this kind of like foreign, crazy, like, ooh, what is that? And all it is a sling of muscles, right? It just holds our guts in from below. Had another woman put it very lovely as she said, it's basically, it's responsible for the 3 Ps. She was like peeing, pooping, and penetration. So
Simplicity.
Yes. And another woman said, oh, it's like the part of your body that's on the saddle when you're riding a horse. I was like, oh, I love that too. So if you're listening and not watching, those are some ways you can really think about the pelvic floor. Just a sling of muscles. It's not some magical, mystical, crazy thing. Now, we will do some visual teaching. This is like, if you're looking from this back, this is your tailbone. And this is like where you put your hands on your hips. If you're standing there with your hands on your hips, right, here they are, and come down towards the front, your pubic joint, right? And here's your genitals right below that. So we're going to flip down. Here's our sit bones that we sit on in a chair. And there's where the saddle. I loved that one. It was like, yes, perfect.
Yes.
All this red is the muscles that make up the pelvic floor. Here's anus, and the rest of the pieces up here. And inside this little bowl, so we often hear of a pelvic bowl. Inside the bowl is the organs. And they're sitting bladder, uterus, and rectum. There it is. All in a nice little stack. But that stack is only supported by soft tissue partitions. So we really are relying on the integrity of soft tissue and muscle here to maintain the lift, the upward, the holding of everything in place, which maintains the function the way we want it to be in all those 3 Ps.
Right. So when you had can you just hold it up one more time? When you were showing the bottom. So when you were talking about Jen growing up with asthma, I think this is really important because a lot of women probably had something like this. Show where that would impact, like all the pressure would be.
It goes
there.
down. It goes
Just like when you're.
I literally just shared a reel on Instagram. I love doing visuals, right? Where I'm like, if you haven't strengthened your pelvic floor functionally since having kids, this is what happens every time you jump, laugh, cough, or sneeze. And I've got a sling of thin pantyhose. So instead of robust muscles, it is now weakened and stretched. And I've got some little mandarin oranges in it and I'm bouncing them. And it's like, and you wonder why there's a leak, there's pressure, there's heaviness, there's dysfunction, incomplete emptying, urgency, because the functional integrity, that up and in strength that we had before is no longer there.
There you go. And that's such a perfect visual for those who are listening to the audio on the podcast. Picture a set of pantyhose with mandarin oranges bouncing up and down. I mean, that is pushing on those muscles of the pelvic floor. right? No wonder. No
Yeah,
wonder. And
and no wonder.
I love those educational pieces because this is our body, right? And I don't know why I mean, if I weren't a chiropractor, I would not have that visual in my mind.
And I wouldn't either.
Every woman should have that visual, but we're like never walked through our body that intimately. So
I
it's a
know.
mystery. And just going back to something you said, like when you first decide that this is an issue, right? To me, when I hear that, I hear an awareness. You create an
Mhm.
awareness, and that takes a lot of courage, I think. But that is the
Mm.
first step in your new life. That is the first step in like seeing the light because the
Yes.
solutions are not that hard. It's
Yes.
getting to that place. That's where it all changes. And so, just going back to the visual, like creating an awareness of what your body looks like and functions like is something that we should all have because that is so empowering.
And our hope is that, like, we do a lot of teaching with this on our YouTube channel too, our handy little pelvis model, because so much of what we hope to do is help women feel seen, heard, and validated. Because so often the comments under these teaching videos are like, I've been to 5 doctors and no one explained it this well. It's like, well, what? Why, why is this what but that's why we constantly are teaching on there, because it's like we've lived it, we know what it feels like. And well, there's a lot of confusing terminology around all this. And so women are like, well, I was diagnosed with that, or I don't really want a diagnosis. Can you just tell me how to fix it? So we want
Right.
women to feel seen, heard, and validated through this teaching, but we also want to take the fear out of it, right? Because if you just hear pelvic floor and your mind kind of goes into like radio static, like, what is that? What does
Right.
it mean?
Right. You can't even visualize it. So you don't even know what you're working with or talking about. Yeah.
Mm-hmm.
Okay, so a lot of my listeners probably are around the age of like 35 upwards to like 60s-ish. So let's talk about perimenopause and how this might impact pelvic floor and maybe some challenges show up that women haven't yet experienced previously until this moment in their lives.
Yes, absolutely, yes. And so often this is around the threshold where a lot of women are at that point of like, wait, this is like really a problem now. It's no longer just a mild annoyance, because estrogen starts to drop, and it's all natural changes that our body goes through. But if there were some pre-existing weaknesses and underlying issues, this is often the time where we feel them more and they become more pressing and bothersome, because by our 50s, estrogen drops by 50%. At least that's what the way I've learned it. And then as estrogen drops, collagen also drops. And we like to kind of think of that as like, well, now it's my saggy face and it's like a vanity issue. But it's also, and anywhere else there's soft tissue issue, which we just talked about, the full support of our pelvic organs is soft tissue. So guess what else is impacted by that estrogen and collagen loss? Our pelvic floor and the function down there.
Let me give everyone a visual for that. So if anyone, I saw this on Instagram, like someone went viral doing this, and I'm like, I love these women. Has anyone looked at their knees lately when you're in down dog doing yoga?
Saggy knees.
I'm like, when
I
the heck did that happen?
Uh-huh. Uh-huh.
That's that lack of collagen. So you're saying that same thing starts to happen in the pelvic
Mhm.
floor. Mhm.
Mhm. So this is
Mhm.
often the time of life when women all of a sudden are like, okay, I can't anymore. Now this is a problem, as opposed to
Yeah.
an annoyance that I just didn't like before. So that's a
Mhm.
lot of times when women find us, and it's a perfect time to take action, because there is a point. So this is not to create fear, this is to create inspiration to take action and not wait till it's too late. If you are a woman who does not want to end up as a surgical consult at 55 or 65, listen to your body at 35 and at 42 and 45, because part of, like I said in that quiz, part of what we do is tell you, are you a good fit based on our data and research for a conservative approach to healing. And there is a point, this is not as much age related as it is severity of symptom related. There is a point at which a conservative approach is no longer going to be enough. So don't let it get there. If you're a woman who doesn't want to go there and have, a major pelvic reconstructive surgery with a 25% failure rate, don't let that be you. Start taking action sooner than later, as your body is giving you like every time the dysfunction escalates, it's not your body betraying you. It's your body saying, waving a white flag saying, hey, I really need some support here.
Mm.
Please help me. Please stop doing the things that are making this worse. Please give me that gentle care that I need to show up for you for the decades to come.
Well, so much of our body speaks in whispers, right? And we've just forgotten how to listen, or we're just too busy and we don't listen. And then it has to turn into a scream before we do. And like you
Yes.
and I have experienced, that becomes our message. But like, let's not wait until that point because, like you just said, like, then things are way more difficult to address.
Yes.
How long do a lot of the tools that you guys share with your listeners and audience, how long do those take?
The recovery, we call them recovery tools, the relief techniques that we teach as like, so first, if you enter into working with us in our program, you learn some self-assessments first. You're like, "Okay, where's my starting point?" So that way in 30 or 60 days, you can reevaluate and go like, wow, celebrate all your progress. You're going to notice it in lots of other ways. But Jen and I are nerds for what we do. We love the data. So we like to help women track their progress that way too and celebrate those objective wins. So you first take some self-assessments, then you learn these relief techniques. One of those is that at-home decompression that please everybody start doing. Like there's no
Yeah.
reason not to, as well as some other tweaks and adjustments to toileting positions, some other decompression positions, and ab closure technique for DR and all of that. Then you learn the therapeutic exercise series, which once you've learned it takes 10 minutes a day. And this was part of what Jen and I set out to do, was to dial in a protocol that would fit into our lives as moms. I don't want to paint an unrealistic picture. To get the best results, you do need to take on some of those relief techniques. We teach women how to check their pelvic alignment and let them know that if it's out, they really need to see a skilled chiropractor because, if the bones aren't in the right place, the muscles can't be in the right place and therefore won't be able to be strengthened as effectively. So there might be some steps that you're going to walk through before that routine gets down to just 10 minutes a day. You might have to pour more into getting your alignment back. You might have to pour a little more into those daily relief techniques to relax and release everything before you're going to get the most out of those strength pieces. So in the end, if you're somebody who needs this for maintenance because the tissue injury has gone far enough, it's kind of never going to be the same again, it's 10 minutes a day.
Okay.
But in the beginning, you will have to devote a little more time because, again, it's that holistic process of really getting to the root of why we're here and healing it from the ground up.
Right. Yeah. And I love, it's got to be you're being realistic. Like this isn't something that's just a one-off. We don't take pills, like we're not just fixing things with pills because that doesn't actually fix it. So I do appreciate the time that healing takes. And then of course, I just love the reality of being able to, maintain these things in a realistic schedule that can fit into women's lives.
Yes. And look, and I love to talk about, Jen and I we're much more motivated by function and how our body feels than we are about the aesthetic piece. But we talk about the aesthetic changes that women experience as like bonus side effects because it's not what motivates us to do this for ourselves. But it can be motivating to know that instead of taking a pill where maybe you're having overactive bladder, which is just a term it's basically meaningless. It's just, a fancy word for you need
Drug
some
companies.
strength in your pelvic floor and relaxing in your nervous system. So yeah, you don't have to live with that forever. But so you maybe take a pill for overactive bladder and it dries out your eyes, it dries out your mouth, your lips are cracking. It's unpleasant side effects all around. If you heal at your center with a holistic protocol and get to the root cause, the side effects are a narrower waistline, a perkier booty, and better orgasms. So, which side effects do you want?
Beautiful. Yeah. And with any drug, it's like they just silo it, right? So if you ask one linear question, will this dry up your bladder? Yes. What else is it going to dry up?
Yes.
Like if you just don't look at that whole scope, whereas holistic healthcare, which should not be called alternative, it should be called primary.
Right.
Let's try this first. Is always has side benefits, right? It's so
Yeah.
much more beautiful. Who doesn't want a tighter tummy and booty and better orgasms? Like it's
Yep. And
incredible.
better posture. I mean, it's unbelievable
Yeah.
because our posture starts from our center, right? So women oftentimes the first time they do the therapeutic exercises, they're like, wait a minute. It's always surprises. Like everyone's like, well, I came here for this, but like one woman just yesterday in our private community was like, I came here because of these pee leaks. And I can't believe there are issues I've had from before I had kids that are also getting better. She's like, I didn't even expect that. I didn't expect my posture and my balance to improve. I didn't expect, upward spiral when we heal things at the root. It's just so cool.
Well, and also, I mean, that's your solar plexus. That's your creative
Yep.
center. Anyone who's seen someone walk into a room, heart open, solar plexus open, like there is like a light shining on that person. And what that person is going to magnetically pull and attract into their lives, there's no limit. You're in
Absolutely.
complete alignment. And I don't just say that as a chiropractor, I say that energetically.
Yep. And I feel it in women's bodies and my body work practice, and I see it in the comments and emotional, incredibly powerful interactions in the private community of our members because they're on that journey and they're supporting each other too, right? Like there's nothing like being next to somebody who's 4 steps ahead of you because it can feel hard to look these issues in the eye and go, okay, I can do this. But, not only are we there to help and support, but other women who are 5 steps ahead or 2 steps behind you who then you can support because it's like the Lynn who you spoke to about the intention, right? It's
Yes,
it's like when you are all pulling for each other in this space, the energy behind that, you get to then give what you've learned to someone else, and that only furthers your healing journey. I mean, it's
absolutely.
all so good.
It's such a beautiful thing, and, I'm a huge fan of community, so I love that. I wanna wrap soon just so this is digestible for our women with full lives, but I wanna touch on
Totally.
the lymph connection with the pelvic floor.
Yes. Okay. And this is very easy to rope right back in because we've
Perfect.
already talked about how often we get over tight down there, which over tight does not mean strong. It's just a different presentation of weakness because over tight means those little fingerlings that create our muscle contractions cannot grab each other effectively. So it's a different kind of weakness, but over tight is still weak. Okay. So imagine, there's a couple different areas where our body is divided kind of crossways, diaphragms, if you will. And obviously, our breathing diaphragm is one of those, but then the pelvic floor is another. And so, if you imagine all the vessels that return the lymph and our blood flow from our entire leg have to pass through the pelvic floor and hips. So if we are over tight and chronically guarded there, or if we have that kind of falling of the organs out of place where they're kind of slipping and sliding down, imagine both of those things going on, which is very common to some degree. And then imagine what that might do to the little bitty vessels that are trying to feed that returning lymph and blood flow back through the pressure of the falling organs and the pressure of the tightness of the muscles there. And often it presents as nerve symptoms in the feet. You can have numbness. I had a woman who had had a hysterectomy and came to work with us because this was not in our research. She said, can you help me with this? And I said, I don't have data to support it, but intuitively, I think this will help. She was having numbness in both her feet after a hysterectomy because there had been some residual weakness and other things falling out of place. And sure enough, getting back that up and in strength, her feet were no longer numb. But so the lymph, the blood flow, the nerve signals that all pass through those tissues, if they are compromised, creates a lot of people call it pelvic congestion. It can create swelling in the legs, but all of that flow has to pass through the hips and pelvis. So if we've got up and in strength, if we've got freedom of movement and flexibility and soft, pliable tissue, then we're not going to have those issues with the lymph return. And that's a part of our immune system. I mean, it all comes back like if we don't have good lymph return, we have a compromised immune system. I mean, it is, you're going to have more chances of UTIs also if you're not completely emptying your bladder because the tissues are too tight. You can't even relax your pee out anymore. I mean, it is all connected as you know.
Yeah, it's all connected. I mean, it's like a congested highway,
Yes.
right? And you're just clearing all that traffic so that the fluid can go through. Our bodies can function in their miraculous way that they do. But no wonder that we have all these issues when we have blockages.
Yes, it's
It's
just
all
simply
connected.
setting the table for it to do the things it wants to do to begin with.
Yes. Love it. Well, Christina, we're going to link all of your incredible resources below. Thank you so much. And I just want to ask you, is there anything you want to leave these listeners with? Any empowering information or encouragement for anyone who maybe has been struggling with this and feeling alone?
Girl, first of all, obviously you're not alone. I hope if you've only heard one thing that's it. And second of all, you know your body. I don't care how many healthcare providers or friends have maybe tried to dismiss or ignore or shame for these issues. You know your body. You know what's well and what's not well. Trust that. Absolutely listen to your body. If it's giving you those cues, it's telling you its truth. And honoring that will provide the best results always.
Love that. Key back into your body. We are our best guides, healers, intuitives, mentors, gurus, all the things. Christina, thank you so much. You and Jen, your business partner, are doing incredible things, and looking forward to more conversation with you.
Thank you so much, Dr. Melissa. And your listeners can get a $50 off coupon if you feel called to work with us in our signature program. Just the code INSPIRED.
Okay, beautiful. Yep, everything will be linked below for you guys. Definitely check their stuff out. Wonderful information. Thank you so much.
Thank you, Dr. Melissa.
All right, guys, I hope you enjoyed that conversation. So many incredible free tips and resources for you linked in the show notes. I would love to hear your favorite takeaways or any questions or comments you have. Be sure to hit that subscribe button so you don't miss any future episodes with tons of interesting and powerful information for you.